Hello everyone. So today we're going to see about the international patient safety goals, which is the goal number 4. So you all will be surprised of what goal number 4 is. So it is nothing but the right procedure to the right patient, which is enhancing the surgery safety. So we are going to develop this by using the patient safety checklist. So why we use this goal is that we can plan and for identification of that particular site, especially bilateral organs. In case if the patient surgery is performed on right hand, then the right hand that site will be marked. If on the ears or might be on the eyes or on the kidneys or on the might be the bowel. So whatever site when that is bilaterally, then we have to plan accordingly and planning for the correct site marking as well as the procedure which is planned to the patient. So what can be the possible documents to prevent this wrong site surgery is that we'll be planning for the usage of the checklist. So in the checklist, what is the surgery performed to which patient, that is identifying the patient site, the patient name, whether it is the right patient, whether the procedure, what procedure we plan for the patient, whether the equipment around the patient site is working or not. If necessary, then we have to change a plan for a new equipments. Then documenting. So whatever we document onto the patient side, that will be documented by with three persons involved, that is the nurse, the surgeon as well as the anesthetist. So this will be done by using the surgical safety checklist which is done by the WHO, that is sign in, time out and sign out. So this I will be explaining in a new procedure that is in a new video separately of how this sign in, time out and sign out to be used. So this is how the patient safety checklist will be looking. So this has been before induction of anesthesia is done, which is sign in. Before skin incision, we are going to do time out. After the patient is leaving the patient operating room or before the patient is leaving the OR, then we use the sign out. So in this sign in, we are going to assess whether the patient is being identified with the right site, right name, right procedure, right consent. Then whether the site is marked or not, whether the anesthesia medications are checked completely or not, whether the patient's pulse oximetry is also checked, whether the patient is having any other allergy, difficult airway or risk for heavy blood loss is being screened. And this, that is this before skin incision, this is also done by the nurse, anesthetist and surgeon. So here the team members are confirming their names as well as by the name and role. For example, if Mr. Karthik is the surgeon, then he'll be saying, I am Mr. Karthik, I am the chief surgeon, going to start the procedure. So like that the anesthetist also will introduce himself and thereby they start the procedure. Then they are confirming the patient name with the procedure, whether where the incision will be made is also being planned and they are telling it loudly, and whether any antibiotics is being given prophylactically just before 60 minutes of skin incision is also marked. And they also check in for the anticipatory critical events such as what will be the routine steps, if there is any changes or if there is any anticipated blood loss, any other blood transfusions to be planned. All that will be planned according to the patient individualized surgery among the surgeon, anesthetist and the nursing team. Then whether if the patient needs any imaging to be displayed at the particular area, especially at the X-ray lobby if the patient is having chest X-ray. So after the surgery is over, before leave the patient rooms, we are going to check the name of the procedure, completion of the instruments, the instrument count, sponge count and needle count, specimens if it is taken from the patient, that should be labeled loudly along with the patient name, what was the specimen taken, and that should be. And if during the procedure, if they have felt any problem, might be in the syringe pump or on the ventilator or on the suction apparatus, then whether it is being addressed or not. All that are done in the sign out. So this is how a patient's safety is being maintained. So this is the last, that is the fourth goal in the International Patient Safety Goals. Thank you. Don't forget to like, subscribe and share. Please, if you have any doubts, don't forget to put it onto the suggestion box.